Because patent life can be extended if new indications are approved, companies are constantly searching for new diseases to treat with old drugs. Antidepressants of the Prozac variety, or SSRIs, are a good example of this practice. Originally approved for major depressive disorder, these drugs are now prescribed for a variety of mood and anxiety disorders. Each new indication approved promises increased profits and must therefore be promoted heavily to the public. A striking example is how Paxil was revitalized as a treatment for social anxiety disorder. Its company hired a public relations firm to frame this condition as a major and common medical problem, and the firm launched a multifaceted campaign that moved beyond advertising to get stories about social anxiety disorder placed in print media and on television.
This morning we begin a special two-part series on social anxiety disorder. Many of us have suffered from shyness or fear of social situations at some point in our lives, but for millions of Americans, their anxiety can be debilitating.
Paxil's award-winning product director was quoted as saying, "Every marketer's dream is to find an unidentified or unknown market and develop it. That's what we were able to do with social anxiety disorder."
What it is, what it feels like, what it is, what it feels like, what it is. We know what social anxiety can feel like, and Paxil can help.
When people begin to critique these advertisements and these campaigns, I think it's a little easy to actually forget about the people who do suffer from social anxiety disorder, who suffer from major depression, who suffer from post-traumatic stress disorders. You know, there are people who suffer from these conditions and whose lives are radically transformed by the medications, and I think that it's actually important to remember that. That doesn't mean that at the same time we're not sort of creating a culture of the worried well. People who might have this problem are sort of suddenly concerned that they have this problem.
Over 10 million Americans suffer. Do you?
If we take shyness, which is probably a part of the personality of most of us, in some situations, you know, it's an appealing part of people, it's part of their personality. And we turn it into a new entity and we call it social anxiety disorder. Now you've increased the size of the market. Now you can go out and you can advertise Paxil for social anxiety disorder, for somebody being shy.
The Paxil CR ad reads to me a little bit like medicalizing normal experience.
If you are one of the many who suffer from overwhelming anxiety and intense fear of social situations with unfamiliar people, now there's Paxil CR. Paxil CR helps relieve the symptoms of social anxiety disorder all day, so the real you can come through.
You have people who look mostly comfortable, but you know they're a little uncomfortable in a social setting, and we're turning that into a condition that needs significant treatment. You know, the SSRIs have a million side effects. They're not clean drugs, and to suggest that if you have a tough time going into a meeting and introducing yourself to people, you should be on an SSRI, I think is problematic.
We are going to take a closer look tonight at the possible link between antidepressants and suicide.
The other disturbing aspect of this class of antidepressants was the fact that these drugs were being prescribed to a large number of children.
About 1 million children under 18 take such drugs now, with doctors writing 3 times as many prescriptions as they did a decade ago.
And we don't know if the drugs were being used appropriately, if they were being used in children with major depressive disorder, or they were being used on a 12 or a 14-year-old boy that didn't make the football or the basketball team, and he felt sad.
So you have this kind of system that has no brain, you know. It has profit as its goal, and it has no mind, and it just builds the market without thinking about, are there other ways we can deal with this? Is this something we want to pathologize? Is it something we want to see as a sickness?
Critics have pointed to Prozac's reintroduction as Sarafem as one of the most disturbing examples of how companies simply promote new conditions in order to repackage old drugs.
It's that week before your period. The irritability, mood swings, bloating. Think it's PMS? It could be PMDD, premenstrual dysphoric disorder. Those intense...
What Eli Lilly was very successful in doing to expand its market on Prozac was to essentially recolor it. Instead of a green capsule, made it pink, rename it Sarafem, and get approval to market it for premenstrual tension, which it called premenstrual dysphoric disorder.
Drug manufacturer Eli Lilly launched a $30 million marketing campaign to inform women about their new drug that promises relief.
The problem is Sarafem is not new, and the condition it's being advertised to treat might not even exist.
Prozac and Sarafem are exactly the same thing. It's all a matter of image.
Sarafem, the first and only prescription medication for PMDD.
Once again, the pharmaceutical industry, through its advertising ingenuity, is able to sell us almost anything, even old drugs as new drugs.
A lot of women would really be outraged if they knew that they were just taking good old Prozac, same dose, but priced, at my drugstore anyway, over 3 times as much as generic Prozac.
Fueling the debate, Sarafem's marketing blitz started just before Eli Lilly lost its exclusive patent to sell Prozac, a drug that generates $2 billion in sales each year. With Sarafem, the company obtained a new patent, and for now they are the only company that can market a treatment for PMDD.
This whole process of creating disease awareness is controversial, and I think it's sort of a question that we should decide as a society. And what bothers me about it is that it's being promoted by an industry that has its own motivations, which have nothing to do with our culture or our physical well-being or really our health as a society.
I can't help but think that there are millions of Americans who are taking drugs that they probably don't need and may be even harmful. That they're being convinced, and their doctors are being convinced, that they should take lifelong drugs that probably are of no net benefit and may be of net harm.
Clearly, in our culture, we tend to look for quick fixes and pills that can, and this has really been the emphasis, whether we're talking about obesity or any other health problems. Certainly the direct-to-consumer advertising feeds on this.
We don't look at environmental problems that might be causing asthma or causing these allergies. We don't look at lifestyle issues that might be causing depression or causing, indigestion and so forth, or erectile dysfunction for that matter. Instead, we just sort of talk about it at the level of individual biology. And so that means we're not looking at social causes. It means we're also then not looking for social solutions.
I think it's very important for patients, in a sense, to give their doctor permission not to prescribe a drug by saying to the doctor, no, I don't want a drug unless I really need a drug. And then if the doctor, who will be taken aback by this, says, well, yes, I really do think you need a drug, then it's up to the patient, or I think the patient should say, is there something, even though this is a free sample, and I may use this free sample until it runs out, is there a drug for the same condition that's cheaper, or is there a generic?
You really need to be your own advocate, and you need to be educated, and that means spending a lot of time doing research about any medication that you're going to take, any healthcare procedure that you're going to undergo.
Consumers really need something to protect themselves. We look at our publications, Worst Pills, Best Pills, as a source of information for prescription drug consumers. Not only do we do a book, a newsletter called Worst Pills, Best Pills News, but we now have a website to give people objective comparative information so that they can decide for themselves, so they have something to balance the advertising.
Groups like Public Citizen have been working tirelessly to arm consumers with important information. Also necessary, say advocates, are campaigns to tackle the industry's mass targeting of our healthcare providers. While direct-to-consumer advertising remains the most visible aspect of the drug industry's overall marketing approach, The real story lies behind the television screens. Invisible to most consumers, the majority of pharmaceutical promotion is still directed at medical professionals. Increasingly, drug companies are pushing their brands at medical conferences and in medical journals. In addition, there are close to 100,000 industry sales representatives who spend countless hours visiting hospitals and physicians' offices and leaving behind branded items to remind both doctor and patient who they are and what they're selling.
Anyone who's been a patient or has ever set foot in a doctor's office know that the offices are just flooded from clocks, pens, coffee mugs, calendars with branded drug names on them. In fact, if you pulled over any medical resident or medical student who is wearing a white coat, and there have been studies that have done this, likely almost all of the things in their pockets would be